Welcome to ET Healthworld's special episode in association with Novo Nordisk. Today, we spotlight a growing yet often underestimated crisis, obesity in India, and explore why it needs to be treated not just as a personal health concern, but as a national healthcare emergency. With changing lifestyles, increasing urbanization, and persistent social stigmas, obesity has evolved into a complex, chronic disease, one that demands a multidisciplinary and compassionate approach. Joining us today for this very critical conversation are three esteemed experts who bring deep insight and frontline experience. Please join me in welcoming our panelists today. We have with us Dr. Nandita Palshekar, renowned gynecologist and infertility specialist, Dr. Aparna Govilbhaskar, renowned bariatric and laparoscopic surgeon, and Dr. Tejas Shah, who is an endocrinologist and diabetologist. Together, we'll explore the biological, psychological, and societal dimensions of obesity, its impact on reproductive and mental health, and why holistic management beyond weight is essential. Let's begin this much needed dialogue. I'll take my first question to the other side of this panel, to Dr. Shah. Could you share some insights about the current trends in obesity in India and what's driving this rapid rise?
So, if you see the numbers itself, and if you go back 10 years down the line, the numbers in fact have almost doubled. So, what the latest estimate tells us is that the incidence and the prevalence of obesity is as high as almost 23 to 25% in males and females. And the numbers are expected, or what the prediction is, that by 2050, we'll have almost 30 to 33% of the population will be obese. So, the main reason for this sudden rise is multiple factors. If you take together, the urbanization, the sedentary lifestyle, the abundance of food, and genetics. These all play a role together, and that's the reason we are seeing this sudden rise in this problem called obesity.
Well, yes, multiple factors, too many factors, which we will be exploring in detail during this panel. I'll take my next question across to Dr. Palshekar. Doctor, what sort of pressures that are cultural and societal play a role in obesity, especially when it comes to women?
In our country, women, the 50% of the women have an abdominal obesity, and that is really bad. And sometimes you have the thin, fat Indian women who have a waist which is more than 80 centimeters. But, there are multiple factors which affect women. I think, as, he said, talking about sedentary lifestyle, but also the culture. In some of the cultures, it's very difficult to get out, exercise. That is one. Then the body image, size 0. So women are trying to get thin and they don't, and they overeat. They go into depression, mental health problems. I think those are also a problem. And also, of course, that women don't prioritize their health. In our country, it's majority of the women, they are like, okay, whatever is left over, we will eat. And the Indian diet, is so rich in carbohydrates. I mean, the vegetarians don't get enough proteins, and there's a lot of carbohydrates in our diet. And our genetics, we are prone to metabolic syndrome. We are prone to, like, Indian women with PCOS actually have 30% of them have a gene which prevents them from having satiety. So all those things add up, and the women really suffer in the long run.
That's very true, and I think you speak for every woman here. I know I can relate to so many things that you're saying, right from the fact that there's not enough space to go out and exercise as part of genetics, or the fact that carbs are, such a primary part of our diet, especially
and
in
remember,
India.
Women like you, all of us are multitasking.
Yes.
So maybe we don't have time enough to exercise.
Absolutely true, and I think that really compounds for women. As you said, I'll take my question across to you, Dr. Bhaskar. When it comes to biological mechanisms, what role do they play in obesity?
So, First of all, obesity is a chronic, progressive, and also a relapsing disease. And it is now known that it is not just about eating food and spending that energy by working out. So it's not just about calories in and calories out. It is multifactorial, and there are multiple factors which act at many levels. And one of the most important factors is genetics. So almost 70% of obesity can be attributed to genetics. It is also neurological in nature. So a lot of it is controlled by our brain. So we have patients who come to us for weight loss, and we've seen that they've been chronically on diets, and yet they continue to gain weight. Then it is also hormonal, like Dr. Palshetkar just mentioned, that conditions like PCOS, they play a big role in this. And so there are multiple things. And of course, diet, lifestyle, stress, and sleep. These are things which also play a huge, huge role in weight gain and obesity.
Doctor, you've given us a great overview, and a lot of people do know this, that there are multiple factors that contribute towards obesity. But one thing that I'm sure obese people, overweight people constantly hear is that get up, just go and work out, change your diet. So I'll take this question across to Dr. Shah. How would you debunk this myth that, just working out or a lifestyle change can bring down your obesity?
See, lifestyle is the first step for anything. If you look at, we always say that there's a very interesting saying which I've heard, that it's genetics which load the gun, but it's environment that triggers the bullet. If you don't do lifestyle practice and lifestyle modification, you will not go to the next step, is what I believe. So lifestyle is important, it is necessary. After a certain extent, when the lifestyle is not able to further help you to lose weight, maybe that is the time when the role of all other things come in, be it medications or whatever we are talking about, surgery, medications, all have an important role now, because the amount of the weight loss and amount of change that we want in an individual maybe sometimes is not only enough with lifestyle, but without lifestyle and without exercise and diet, you will not be able to go further.
That's very
Can
important.
I interrupt
yes,
here?
Please. Yes, please.
I totally believe what he's saying,
Sure.
but there is something called biological adaptation. That means what? You've dieted, you've exercised, and then you suddenly plateau. All of us have gone through it.
Yes.
You suddenly plateau, and no amount of diet and exercise is making you lose weight. So I feel, we've been struggling with this all these years. Today, we have help. So I feel this lifestyle changes plus medication would really help those people who need it.
Yes.
So a combination would work beautifully. That's what that's my personal opinion, of course. And you have to do diet and lifestyle.
I
There's
absolutely
no
agree to what she's saying, that now for so many years we've never had the right kind of approach and right kind of medications, and we were getting stuck only with lifestyle and diet and exercise. But now we have tools, so the time has come when we need to use those tools at the right time, and then the result will be much better.
Yeah. Multi-pronged approach for a problem that has multiple factors.
Absolutely.
So
Wow.
that's
You hit the nail on the head.
No, but it's great to know that, that so long, so many people have been struggling with just a lifestyle change, diet change, and they must be tired of hearing this as well.
Look at us,
And
no,
now
we are
they have
all
some help.
exposed to the
Yes.
same thing.
Yes.
All of us eating the same thing, but you're thin. I mean, look at
No,
me,
it is
the others.
true.
So everything affects each one individually. So
Very
I think you
differently.
need a mix of basket, that life, diet, exercise, and medications. I think that would really help the modern Indian woman, man, anybody.
And especially women, because I hear it can affect reproductive health as well.
Yeah.
Is that true? Do talk to us about that, ma'am. And also, are there any interventions that can improve fertility outcomes?
Yeah, I think, what we need to understand is that, first of all, it's very difficult approaching a patient to tell them about their weight issues. So I think it's, the doctor has to be sensitive. The doctor has to have empathy because, first of all, they are not conceiving. So it is a lot of mental trauma. And on top of that, if you put the blame on the weight, it really does bother them. So I think it's better to get the girl alone or the man alone. Even men, the sperm count is affected by obesity. So it's better to talk to them individually. And counsel them, because obesity, it affects all phases of reproduction, the egg quality, the embryo quality, even the uterus. So all this, meaning anovulation we call it, meaning you don't ovulate. Okay, so because of the hormonal imbalance, all these problems occur, and the pregnancy rates are a little lower there as compared to the normal patient with the normal BMI. So I think this is very, very important. And also complications during pregnancy, like miscarriage rate is slightly higher. You can develop diabetes during pregnancy. You can develop blood pressure during pregnancy. All these problems. And even the vaginal delivery sometimes becomes difficult when the patient is really overweight or, is having weight issues. So I think we really, now what I do is, I counsel them before they get pregnant. We can try and get them to get fitter.
Ma'am, apart from the information that you provided, I feel what really stands out in your answer is the compassion that you have for them, right from the fact that you said you speak to them alone. And also I noticed that you said vaginal delivery and not normal delivery, as many other doctors tend to do, So that's really beautiful, in addition to the information that you provided us, of course, ma'am.
Because we don't want to stigmatize anything.
Absolutely, absolutely. And I think that's the first step to healing, indeed, for somebody to understand you and empathize. Now, when it comes to obesity, it's not just about the way you look, it's also associated with long-term risks. Dr. Bhaskar, can you walk us through some of those risks that you are seeing long-term in patients who are obese?
Yes, so I think first of all, what I would like to begin by saying is that obesity is one condition where I think the first step is to establish that yes, it is a disease, you have a problem which can lead to multiple problems in future. And when we talk about problems related with obesity, I think this is one condition which affects the human body from head to toe. So in the head, it can cause raised intracranial tension, and in the toe, it can lead to gout. In between, you have metabolic problems, which could be diabetes, increased risk of high blood pressure, increased risk of heart disease, increased risk of high cholesterol. Then you have problems which are related to movement, so mechanical problems. So that could be related with joint pain. So we get a lot of patients from orthopedic clinics because they go there for joint-related issues because of the weight. And obviously, they can't get treated for it unless they lose weight. And how would they lose weight if they can't walk? So it becomes like a vicious circle for them. Then breathing is a big problem. So we've had patients who don't walk, who cannot even walk for 2 steps without becoming breathless. So climbing up steps, even taking a glass of simple water for themselves is a big task for them. So what we see is that people start limiting their activities unknowingly sometimes until they actually get confined to their own homes. And we've also seen that obesity is one of the biggest causes of liver disease now. In fact, I think its incidence is higher as compared to alcohol-related cirrhosis as well. And most importantly, I think the mental and the psychological issues which come with obesity, which most people don't understand, because only a person who's living with obesity knows what they're dealing with. So there's a very high rate of depression, very high rate of stigmatization, body image issues, and so on. So it's a huge multitude of problems which are associated with this one condition.
Absolutely. And you hit the nail on the head when you said it's a vicious cycle. Yes, ma'am.
250 plus symptoms because of obesity. People don't realize it. That right now you may feel healthy, you're young, you are absolutely fit, there's no diabetes, no hypertension. But in the long run, it erodes your body. And that's where I think people need to be able to accept that this is a condition which you need to ask help for.
Yes.
I think that awareness is the first thing that we must actually project, because 250 plus symptoms needs help.
It's a medical condition, it's not just a lifestyle
Yeah, it's
problem.
a very serious medical condition, and it's also related with multiple cancers. So increased risk of multiple cancers, especially in women, breast cancer, endometrial cancer, and in everybody else, colon cancer, pancreatic cancer. So the risks are very high, and it's proven in multiple studies now that if the weight is higher, then the risk of these cancers would be higher.
Well, through this conversation, I am increasingly understanding that it poses a huge risk to women, obesity, and as always, women have it harder than men, of course. I'll take this across to you, doctor. No laughing matter, of course. Sorry about that. But talk to us about insulin resistance. Is that also affected because of obesity? And again, does that affect the reproductive health of women? What are the studies saying?
Absolutely. I mean, insulin resistance is a factor which is which is the center point, you can say. And it's like the chicken and the egg again, like what comes first. But insulin resistance leads to various problems. When if you have insulin resistance, there are chances of developing diabetes, pre-diabetes more. Obesity itself comes in as one of the main reasons because of insulin resistance. A person with insulin resistance will have more and more insulin production happening in his body, and that itself leads to more appetite, more weight gain, and it's like a vicious cycle. Now, when you talk about insulin resistance in women, the major factor is PCOS, which is a problem which Nandita is there to talk more about, but that is again the root cause in women, which leads to various problems, as we know, infertility, ovulation problems, and so on. So insulin resistance needs to be tackled much more earlier than actually we find out or document it. It's there in a person, starts much more earlier. You need to catch those signs, small signs, which you can see in a teenager itself, that this child may go towards insulin resistant state. There may be features on his neck, in his body, which you need to target. A strong family history of diabetes will make him more prone to insulin resistance. So you need to target insulin resistance much more earlier, and it could be one of the factors which would prevent a person from becoming obese later on.
All right, and also I'll take that point about PCOS across to you, ma'am. So many women, so many Indian women who are overweight often find out that they have PCOS. Seems to go hand in hand. So why is that?
So, every obese woman is not PCOS.
Yes.
I mean, that is something that you have to learn to differentiate because the treatments are a little different. But yes, as he says, I think the waist circumference. Today, there's a lot of change in concepts and all, but the waist circumference in an adult woman, if it's more than 80 centimeters, it means she has insulin resistance. Okay. And if she has other signs like a lot of androgens, excessive androgens, hair, acne,
Hirsutism.
the hair fall. Now, those are the signs of PCOS. And I think PCOS is something, I practice in Delhi also. Every 1 out of 2 women are PCOD. In the south, again, it's pretty common in Kerala and all, that there are more PCOS. And it's all because of genetics and our diet and our lifestyle, our sedentary lifestyle, our carbohydrate-rich diet, all that pushes the women into this. And remember that it's not only women who are insulin resistant, men also. So the father can transmit the insulin resistance to the child, to the girl.
Yeah.
I mean, it can come from the father. The mother may be absolutely normal. So I think we need to be aware of this, and more of those games on the TV or this, we need to kick them out of the house to run, to play, to exercise, and junk food. Yes. I think it's really, really important. And these PCOS girls then have infertility. 30% of them will conceive naturally, but 70% do have difficulty and they will need help. Also, there was a very interesting thought process. As Tejas was saying, that even younger children, it has been found that if you are obese in your teens, you will have infertility later on. So I think it's very important to have a preventive care. And with this new medicine on the horizon, I think I'm very excited about it, that we are looking at something that will help our patients, that will get us to reverse it. And it's actually reversible.
It is.
I mean, all the problems become reversible. So I think it's a fantastic discovery that has actually come in. It should not be abused and people should not get scared. So I think it's important that more awareness, the doctors talk about it, the doctors identify the patients to treat, and it'll really help.
I also, yes.
No, I mean, it's the most scientific way. See, otherwise you'll see billboards everywhere and claiming to lose that will make you lose weight, and they will charge you per kilos.
And also harmful side effects of those medicines.
But this is the most scientific way by which we know what will work and how you are targeting the right areas, which is responsible for causing the problem.
Absolutely. And yes, ma'am, you were saying something.
No, no, I'm
Oh, okay, adding to that.
We are on the
this
same
is-
page.
On the same page, okay. This is so true because for years, if not centuries, people have been looking for a cure that they can take, in form of a medicine. And they've been sold all these snake oil medicines and these magic pills, which have never worked so far. And now there is a scientific aid which has helped people across the world, and it's now here in India as well. Earlier you spoke about the mental repercussions that obesity can have on women. What is the sort of guidance, and I'll ask you this, Dr. Bhaskar, that we can provide to people and also to women who are affected by obesity? They must be worried about the reproductive outcomes, and now I'm listening to all the other problems, that it could be insulin resistance, it could be so many other symptoms that you develop because of obesity.
So, see, actually, there's a lot of internal stigmatization when it comes to obesity, and whenever anybody walks in for a weight loss treatment, the first statement is, it is my fault. I didn't do this, I couldn't stick to this, I couldn't do that, I couldn't maintain a diet, I couldn't go to the gym. Because the thought process has been all wrong all along, and we've always thought that just eating less and moving more is going to lead to weight loss. So first thing is to counsel them and tell them that it's not your fault. Yes, it can be prevented to some extent, just like we can prevent diabetes and heart disease to some extent, but we can't prevent it fully. And if you are affected with the disease or the condition, then you need to progress to treatment. And treatment is now available, thankfully. So you need to be under somebody's care. And I think along with the patient, it's also important to explain to the family. And there's a lot of pressure, especially on women. I think Dr. Valshetkar knows that there's so much of social pressure to look a certain way, to, you have all your icons looking a certain way, and everybody wants you to look like that, which may not be physiologically possible for your body, because your body type is different, everybody is different. So I think that needs to be really drilled into people that yes, this is not a cosmetic problem, this is not a self-implicated disease which somebody has brought on themselves, and sometimes it may need treatment. And the treatment has to be as per the stage of the disease. Whatever is the stage and severity of the condition at that moment, that's how you need to be treated. So it could be only diet and lifestyle modification, it could be medications as a next step along with diet and lifestyle modification. And if it's more severe, very severe, then maybe a surgery as well. So this is how we would counsel them. And of course, if needed, a psychologist should always be there to help them, open up more, because there's too much going on in their heart and minds.
And you mentioned surgery. Many believe bariatric surgery is a shortcut. How do you view it, and do you think pharmacotherapy is essential?
So again, I think why it's viewed as a shortcut, because people don't understand the complexity of the condition. It is very difficult for a person who is, say, 150 kilos or 180 kilos to be able to lose weight all by themselves. And they would need help. And till now, we didn't have any pharmacotherapy. It's only come in now in the last few years. So I think a combination of pharmacotherapy and probably surgery in some cases might be a very, very good way to go ahead. And of course, like I said, there are gradations of the disease. So surgery is reserved for the very severe cases. But there's I think there are billions of people in the middle who are not benefiting from diet and lifestyle alone, and who may not be eligible for a bariatric surgery, but they do need to be treated to downstage their metabolic issues. So I think that's where pharmacotherapy is really going to be useful.
All right. I'll take that across to you, ma'am. Would you have to weigh in?
Yeah, you know what? I feel that everybody doesn't respond to the medication. You have to remember that. So those who don't respond to the medication, I think Aparna would be there to help them out, do the surgery and help them out. But even with the surgery, I've had patients who've had surgery and they've got pregnant. We've done IVF on them and all that. They need help throughout pregnancy, the breastfeeding, and after that. So I think it's a continuum of care, which we need to remember that the adolescent child, then the reproductive age woman. And also remember one thing, in pregnancy, if you conceive and the woman is a little overweight or weight issues, the child in later life also has weight issues. So a child who is born to a overweight mother can have a problem later on, of overweight, of diabetes, of blood pressure, all these problems. So that is why we say that the pregnancy is very important, because it kind of paves the way for future health of that child.
Ma'am, you mentioned pregnancies. So is it different stages of women in their life, be it puberty, pregnancy, menopause, is it required to treat obesity differently at these stages?
I think in pregnancy we cannot use medication, so it has to be lifestyle and exercise. When you're breastfeeding also, these medications are not indicated at all, so it has to be lifestyle and exercise. But after she stops breastfeeding, definitely. And even in IVF, we have to stop the medicines 2 months before putting in the baby. So what I normally do with my patients is, if they come to me and I get very good eggs, I first create a bank of embryos for them. And then when we have to do the the embryo transfer, that is making her pregnant, that time we stop the medicines. So that way. But you have to be careful, because once you stop the medicine, the appetite may increase. So you have to, lifestyle and exercise, as Teja said, is very, very important, and the girl has to do it. And there are some unconventional ways which I use, which I'm not going to talk about, but it definitely helps. And if the quality of the eggs is not good, I'm not getting good quality embryos, then I make her lose weight first, and then go in for this. And while you get the eggs out, you can actually continue the medications. That's a process of egg retrieval in IVF. So on that, I can keep the girl on medications. But before putting the baby in and getting her pregnant, we have to stop it for 2 months before.
All right. So medications at different points for different people. And also, is it true, Dr. Shah, that obesity affects people differently? It could affect men differently, women differently, and people at different stages in life. What role do genetics play here?
So I think, first of all, to answer your first question, whether it affects differently, I think it definitely, if you look at the different age groups, now it will, a teenager or a school-going kid or a younger person with obesity will have different issues. Will have different issues because it's more worried about a physical appearance at that stage, and may not be thinking about the long-term problems that obesity will be causing. So he's more thinking about cosmetically how it is affecting him. A person in a childbearing age, a lady in a childbearing age after marriage, or a individual in a later age will be more concerned with those problems, where how obesity is going to affect the later on life, what problems it will affect. An elderly individual, if you see, will be troubled with obesity by other issues like osteoarthritis, sleep apnea, all these problems set in cardiovascular issues. So at each stage of life, the problems will be different, and the person has to tackle them in a different way, is what clearly, if you see.
All right. So the onset of obesity can be at any stage in your life, evidently. Doctor, now we are approaching the end of this interview. But as my closing question, I'd like to ask you, earlier obesity was so difficult to deal with. Now in 2025, how has it become easier for doctors and for patients to deal with this? I'll start with you, Dr. Shah, and take that along here.
As you rightly said, we didn't have the right approach, and we didn't have the right medications to treat obesity till now. It was lifestyle and advice on exercise, and then a patient had to go to Aparna straight away because there was nothing in between. But now we have this wonderful medications which are scientific, which are true, they work wonderfully. We don't have to worry about the side effects that people sometimes are worried about. Those are myths. Let us very clearly tell everybody who will maybe see this that except certain things like initial nausea and vomiting and loss of appetite initially that some patients may face when they start the drugs, apart from that there are no long-term bad effects that we see or what the drugs have been studied. The amount of weight loss that these drugs cause is phenomenal. But when you start these drugs, patient has to know that these have to be taken for a longer period of time.
So, very interesting point there, doctor, that there's been a lot of scaremongering about these drugs, especially Indians. They often say we don't want to put chemicals in our body, right? Which is funny because water is also H2O only. Everything has a chemical compound at the end of the day.
Never thought of that, Shilpa.
Yeah. You know, so it's something that's often spoken about here, that this is too artificial, it's an artificial aid. When you encounter such beliefs, how do you tackle them, doctor?
First of all, I would like to really tell everybody that these drugs have been there for more than a decade. It has been used in diabetics, and millions of women all over the world have used it, men and women, for diabetes. So I think we should first of all get over the fear that it's a new drug, what are its side effects, what will happen and all that, because it's been there for a really, really long time and the adverse effects have not been shown to be anything that scary at all. That is one thing. And the second thing is that once you stop them, yes, your appetite will go up. But say you've lost 20%, you may gain 10% if you don't take care, because obviously what these medicines do is they curb your appetite. Once you stop it, your appetite goes back to normal. So obviously you have to understand that it is a long-term treatment. Also, these drugs have very good effect on your heart, on your kidneys, on your liver, the multiple problems which Aparna mentioned. So I mean, the weight loss is just one part of it, but it has a good effect on all the other systems of your body. So I think you need to understand that if you are in that age group where these, especially women, when we enter menopause, we lose our estrogen, progesterone, the protective effect on the heart goes away. So these medicines can actually directly also have a protective effect. Studies have shown, obviously, that protective effect on the heart, then your bone health. So many problems which arise in menopause can actually be taken care of by these medicines, and obesity is going to exacerbate it.
Okay.
So I think it's really important to sit down, counsel a patient, explain to a patient so that they go on long-term therapy.
Okay, so I think this ties into what you had said earlier, 250 symptoms of obesity.
Yeah.
And so many are going to come down once you take this drug. Yes, yes.
Just to add to what Nandita said, that even before these drugs came or they were approved for obesity, they were already approved for patients with diabetes with somebody with a cardiovascular disease. If you look at the guidelines, more or less, they clearly say that any patient with diabetes with an established cardiovascular disease, these are the drugs you use first and should be given to them.
Okay.
So naturally, these are very, very safe drugs plus some other benefits.
Okay, so no contraindications on the heart for sure. In fact, added benefits.
Added benefits on heart and kidney.
And on your overall well-being.
But of course, don't take it without a doctor's supervision. I think that's important because, they are just available freely sometimes and people just self-dose. So I think you need to be under a doctor's supervision.
Absolutely, yes. Not without doctor's supervision and not because it's a fad.
Yeah, exactly.
It's because you need it, is why you need to turn to it. Yes, doctor.
So I think the best thing that has happened because of the drugs coming in now is that there's a renewed focus on obesity, which I think we've struggled for so many years to make people understand that yes, this is a medical condition and you actually need treatment, because treatment was not available. So fortunately now the treatment is available, and I think that empowers doctors as well, because earlier it was, you feel that you're not able to help them as much. So now that you have a tool in hand, I think everything should get better for people.
Yes, that's so rightly said, doctor. Even as a doctor, if you feel that sort of helplessness, I'm sure so many patients felt it. And now we've seen over the last year or two, so many people getting a renewed lease of life. You know, they've become a whole new individual. They're leading a better life, emotionally feeling better. So I think the effects and the benefits are there right now, and it's great, especially when for those who've given up on obesity and given up on that struggle or that battle, to get up and fight against it again. I think it's been a great aid, and it's been a great conversation here. It's been a great invigorating panel here, very insightful. I got to learn so many more factors that contribute to obesity, and also what compounds in your body once you have it. It's great now that there are all these aids, and it's great that we have doctors such as you to guide patients through this epidemic. Now there's a question of how much weight to lose, right? When I think of weight loss, I think of it as 10 kilos, 1 kilo, 2 kilos, 3 kilo, 4 kilo. How much weight to lose? How does one do that, targeted weight loss?
So, Shilpa, as per the clinical criteria, usually 5% of your total body weight is considered as clinically significant weight loss. But so 5% could actually lead to a lot of metabolic improvement, say on your heart health, liver health, on your joint pains and things like that. But we see that with increased weight loss, so when 5% becomes 10%, then it could lead to better improvement in diabetes remission, it could lead to better improvement in high blood pressure, even better improvement in heart health and all. And so when we see our patients who are extremely obese or living with severe obesity, in those cases, I think even more than 10% could be relevant for them. So, but 5% is minimum that we would need to have with any therapy.
Okay, 5%.
Yeah,
That's
periods
interesting.
become regular
Yes.
and ovulation goes away, especially in PCOS patients when we are talking. I always tell them, okay, you're 70 kilos, you just need to lose 3.5 kilos because that's 5%. You know, so I think it's very important to communicate that with the patient. Then, you know, a lot of obese patients come to me with urinary symptoms, that when we laugh or we sneeze, urine escapes. About 10% weight loss, and these girls are fine. They don't need surgery. They're very happy, and it changes the whole quality of their life.
Absolutely. You know, living with something like that
Yeah.
can be so embarrassing. And I didn't know that.
Yeah.
Sure.
No, that's what 5 to 7% weight loss has shown benefits in reducing blood pressure. The 8 to 10% weight loss has shown benefits in remission of diabetes. So it's just that small amount, but it gives huge amount of benefits. And people just think that I am 120 kgs, I need to come down to 70, I have to lose 50 kgs, how will I do? But no, it's not like that. It's you have to take one step at a time. Aim for 5 for the first few months, aim for another 5 for the next few months, and that's how the benefits will be seen.
Small goals.
Okay.
Small goals.
And
Achievable.
Easily, yeah, very achievable. You can easily tackle. It's not a big mountain you're climbing. It's just a few steps that
Yes.
you can take. So it's great to know. I didn't know, for instance, 3 kgs can make such a big difference. Indeed. Now, you know, for people who are tackling this, who are working with obesity, they're changing their lifestyle, they're changing their diet. And doctor, you'd say that's the number one step, you'd said. But they're still not seeing results. Why is that?
So a lot of factors go into it. The physiological factors are there in our person's body. Hormonal changes keep happening. After a certain time of when a patient is on a certain kind of diet, his patient's basic metabolic rate reaches to a level where more than that it might not help and change. A phase of starvation comes in, and beyond a certain amount, if the patient cannot reduce the caloric diet, also what the patient is able to take or the person is able to take. So these factors all together create a situation where more than that amount he will not go down. And then that's the time we need to step in and do something more to change the kind of food and everything.
Yeah, I think it's kind of a set point which comes and your body feels, oh, we are starving. So then the brain acts, give more hunger, you know, reduce the satiety so that that person will eat. Otherwise, the organs will not start functioning. So I think that is something that happens when you diet too much. And, you know, like eating, you binge. You've lost so much. You have 2 weeks of, you know, no food. And you binge and you put on those 2 kilos in a I don't know, in a jiffy. I mean, that is bad, and that is why the combination, as he says, is really, really good. The set point is overcome with that.
No, you don't binge after 2 weeks, even one day you've not had sugar. At 2 a.m. looking up healthy recipes, 6 p.m. eating dessert. That's how it is for so many people, and also because you're
But that's what, these medications curb your craving for sweets also.
Okay.
So it not only reduces your appetite, your favorite ice cream may lie in front of you and you won't feel like touching it.
I don't know how, I can't imagine what that feels like.
That's the feedback patients are giving us. That the moment that the first 3, 4, 5 days, they just don't want to eat anything.
So side effects have to be overcome. That is the important thing. I think that's what we have to push them, prod them, and help them with the side effects of nausea or anything if there is.
Correct.
So basically, the brain is really notorious, actually. So whenever you try to fast, I think we've all tried diets at some point, and we all know that beyond a point, you can't stick to a diet because eventually the cravings come back, and that happens because the hunger hormone goes up, the satiety hormones go down, and eventually, I think these hormones are the devils which kind of take over the entire system, and then they force you to binge eat or eat the food that you've been craving for. So with the drugs, these hormones are kept at bay, and that's how you can actually overcome the cravings.
This is so ironic. We struggle to make our body perfect, but our body in fact turns against us and gives us these cravings.
Yes,
and
because that's a survival instinct.
Absolutely, so but it also seems very mischievous of the body to do that to us. And when it comes to obesity, right, just beyond weight, of course you're going to look good, you're going to feel good, but beyond all of that, what are the other benefits for your well-being?
So I think they can be categorized into health-related benefits. They could also be categorized into social benefits, mental benefits, and financial and economical benefits as well, because there's a lot of stigma against people with obesity. Even if you have a job interview, I think you would probably be put down at the bottom of the list just because of the way you look. And in terms of health benefits, definitely there's a huge health benefit. So all the conditions that are brought on by obesity decrease when it's treated. So your heart health will improve, diabetes will go down, hypertension will go down, cholesterol will go down, your joints will improve, your fertility will improve, risk of cancers would go down, liver health improves. So the chances of in future, if you have to spend on say a cardiac bypass or an angioplasty or a kidney related issue or a liver related issue, those costs also come down. So there is definitely a huge financial benefit, not only for the individual but for the society at large. And of course, mentally, I think it makes a huge difference because there is an increased, you see that there's a lot of increase in confidence in the person. It improves their relationships as well in and around their social structure, and like I said, it improves their confidence, so it improves their opportunities that they get in life, and I think it makes everything better for people.
Yeah, it sounds like a win-win-win-win-win. Just a number of wins once you lose a bit weight.
Even governments have woken up to the fact because the prediction of the cost burden due to obesity is going to be humongous on the society. So the governments have all woken up and they are doing a lot of programs. And believe me, it's not only in the upper class. You see it even in the lower class because, we had done a police camp for the police families and 40% people were obese because of the diet. So I think education, prevention, nutrition, information is very, very important, and the government, our Indian government is actually working on it. They're talking about Poshan, they're talking about NCDs, non-communicable diseases, and a lot of programs are coming in, and I think we are at the right time and space, as she said, that there's eyeballing towards obesity and treating it.
Yeah, and there's so much talk about protein as well and re-engineering your diet. Ma'am, you have had such a long, illustrious career. So many look up to you, and I'm sure you've treated thousands, if not millions, of patients in person or virtually. Have you seen any surprising benefits to those who've lost weight? Any surprising benefit of losing weight once they're no longer obese? Did you see an effect and be like, wow, I never thought this could happen?
No, I think, losing weight really changes the whole outlook of that person towards life. And I think they've lived all their life under the stigma. So it becomes a really, I mean, that I've seen this girl who was with me initially and everything, trying desperately to have a child and everything. And then, Aparna comes and does a bariatric surgery on this girl, and she loses a lot of weight, and we help her conceive with IVF. But beyond that, she actually became a counselor, for therapy to assist in obese patients. I think that was beautiful because, she understood everything, and then she went on to take a career path in which she could help the world. I think that is something which I found extremely, extremely, very heartwarming.
Absolutely. And I think you had a big part to play in that you are such an inspirational person as well. So I will give you credit, and the two of you credit where it's due. Dr. Shah, anything you have noticed, in patients who've lost weight, any surprising benefit that we haven't gone through yet already?
No, I think there have been a lot of stories, so many patients. Even before the medications came in, some of my patients have undergone bariatric. Patient who had been at a very, very high risk of cardiovascular disease, has multiple stents put in, not losing weight, underwent bariatric, is now without any medications for diabetes, for blood pressure, is just on simple blood thinners, and doing wonderful after losing 30-40 kgs weight, and living a beautiful lifestyle, very, very happy with the decision. So this was much before even before the medications came in. Now in the last few months, from the time we've been using these medications also, in a matter of 2 to 3 months, there have been people who have lost almost 9 to 12 kgs. And they say that we are finding ourselves much, much more confident in terms of where we are working also, as well as in whatever we are doing. So these are stories which will keep coming as and when we are going to see more and more people using and losing weight and doing well. Just to say on a lighter note, we say that you cannot change your genes, but if you can change the jeans that you wear, it will make a lot of difference.
Oh, that is, yeah,
I
that's
think
so
that's
true.
one of the biggest joys, that they can pick up clothes from anywhere. So otherwise, it's so difficult to find clothes of that size, and they're so limited in that. And the other one is that I can play with my children. That is the most common one that I have always heard, that I now can play with my children. So these are the small basic things. I can cook for my family. I can do my things myself. I don't need help. So I think these are very small things, but I think they bring a lot of joy to people.
That's so beautiful. In fact, obesity should not be a stigma. Nobody should be shamed for it. People should not be disadvantaged because they're obese. Unfortunately, they are. And it's great to see that, once they lose weight, they can lead better lives, and that it is becoming easier as well to lose weight. Now, doctor, when people, take off bariatric surgery or pharmacotherapy, they call them shortcuts, right? In fact, they might even shame people for doing it. They might say, oh, this is the easy way out. Why? What is the mentality around that? And is it really a shortcut?
No, it's definitely not a shortcut. So first of all, like I mentioned earlier as well, that this is a disease. It is a medical condition which needs treatment. There is also a whole I think a media onslaught where a lot of people are losing weight, but they're not really talking about how they are losing weight. So it puts a lot of pressure, because I see people every day and they're like, oh, my parents are telling me that so-and-so lost so much weight on their own. Why are you not able to do it? So I think that just adds to a lot of confusion. And I think it's just we need to work against the stigma which is affecting people with obesity. So the more we create awareness, the more we work towards addressing stigma, I think things will become better, and then these things will nobody says that you're taking treatment for cancer, it's a shortcut. Or if you're
Yeah.
taking treatment for diabetes, it's a shortcut, right? If it's a medical problem, you need to take treatment. Otherwise, you are going to die sooner. So you have to take treatment. So I think that's all that I have to say.
You know, that's true. I think because there's stigma around obesity, there's stigma around all the cures around it as well and the treatments around it as well. And you said such an important point that so many people who are taking aid of these medicines now say they're just going to the gym more, or saying they're eating healthy or making a diet change, which is actually quite harmful to other people's mental health, you know, because they're thinking, I'm doing the same thing, I'm not seeing results. And like you're saying, someone's mummy, papa saying, Sharma ji ka beta has lost so much weight by just, you know, taking a meditation or something, which is actually false. So yeah, such a great point that you've made there, doctor. Thank you so much.
Thank you so much.
I think we really enjoyed it, Shilpa.
Thank
You've
you.
been wonderful.
Thank
you know, you got out the essence of the whole thing out from all of us.
Thank you. Not at all. It was very easy. I think all of you were extremely articulate. The way you explained everything was very conversational, very accessible to everyone here, be it the industry insiders who watch our shows, or be it even those who suffer from obesity. I think this is not going to be just an academic program, but something that many are going to be relating to. For instance, I may not be obese, but I have many people who are near and dear to me who are. So it's been very interesting and also personal for me, and it's going to be for so many others as well. So thank you. Thanks so much. Today's episode underscored that obesity is not just about weight, it's about overall health, sustained self-awareness, and evidence-based solutions. Now, as we've heard, tackling overweight and obesity requires a multi-factor healthcare approach comprising of early diagnosis, lifestyle medications supported by pharmacotherapy, and mental well-being. At ET Healthworld, in collaboration with Novo Nordisk, we remain committed to driving awareness and solutions for India's most pressing healthcare challenges. Thank you so much for joining us, and until next time, stay informed and stay healthy.